How long will your knee pain last after your knee replacement? Let's dive into all the different phases of recovery and the different ways that you'll experience pain after your knee replacement. In the first phase, which is the right after surgery phase, that is when you'll experience the most intense pain and the most discomfort because you've just had surgery and your body is working through the repair process to recover from the surgery. This is when pain is most intense and people need the most amount of pain relief during this time. Having a strategy for medication, using icing, activity, and knowing the tools that can help you to relieve your pain is important in this first phase. Next, in the 1 to 2 week mark, you'll get a gradual easing off of that intense pain, but you'll still be in significant discomfort. Now your body is sort of out of the post-surgical initial recovery, and it's working to sort of transition now into long-term repair and recovery of movement and muscle strength. Over this time, you're easing out with needing as much pain medicine, but you're also adding in more activity, so you may find you still are relying heavily on pain medication or different strategies that help you with your pain at this point. Now, once you're sort of out of the first week or two and you transition into the next phase, now it's all about finding balance. This is usually around the 3 to 6 week mark. In this phase, you are adding more activity, you're doing your exercises, you're going to physiotherapy, and you are using hopefully less pain medicine because everything is feeling now that you're getting more movement, the swelling is starting to go away, you've recovered from the actual surgery itself, so your scar is now healing over, maybe you are starting to do a little bit more of your daily activities, and at this point, you're thinking, okay, I maybe made the right decision. I am not wanting to jump off a bridge because this pain is so intense. After this, around the 6 week mark, we call it turning the corner because from 6 weeks to the 2 month mark, your body is starting to get back to itself. You are now doing more activities, you're getting out there, and your pain may still be there, especially if you've, done a new activity for the first time or you've been on your feet for a long period of time. The knee may swell, so you'll have to do extra activities to help manage that. Pain relief is one of the things that can help. But as you get more and more active and strengthen the muscles around the knee, the pain should continue to get less and less. Pain at this point will be a sign that you've either overdone it or that something still isn't strong enough around the knee to help support that new knee replacement. Okay, so now working ourselves into that sort of couple months after surgery, upwards of around 4 months after your knee replacement, this is what we just call steady progress. What you're hoping for is every day you are doing a little bit more in the way of activity and you're getting a little bit less in the way of pain. At this phase, you want to hopefully have weaned yourself off of the majority of your pain relief medicine, but it may be something, again, where you're doing more activities and you find that you do need a bit of breakthrough pain relief in order to allow yourself to sleep or get the rest that you need. At this phase, you're going to be adding in new activities, getting back to the things that you used to do before your surgery, or maybe some new ones if your knee is feeling well. And at this point, thinking about pain as just a sort of a warning sign that you are doing more than you're used to, or that maybe you need to continue to focus on your strengthening around the knee. This phase, the pain is more just a warning sign than a sign that you're damaging or doing something that will affect the long-term recovery of your knee. Now, if you're still experiencing some pain or discomfort at the 6 months or longer mark, you are still totally with the normal range of people who have knee replacements. Often people find it is still, uncomfortable and a little bit painful anywhere from 6 months upwards of a year after their knee replacement. Again, it's not to say that you're doing something wrong. It just means that you still might have some healing and some strengthening or rehabilitation that needs to happen. Or maybe you're just pushing yourself a little too far, too fast, and your body isn't ready to manage that amount of intensity yet. So this is where going back to your rehab professional, asking for a review maybe of your strength and the activities that you're doing, and just set some realistic goals that maybe will be gentler and a little bit slower to add in more activities after that 6-month mark. I know everyone wants to get back to their full life as quickly as possible. But if your knee pain is still really bothering you, it's probably a sign you're just not quite ready for that intensity yet. It doesn't mean you won't get there. It just means you need a little bit more time. I think the hardest thing when you have a knee replacement is being patient and keeping in mind that the end will come where your knee pain can be resolved completely. But it is really difficult when pain day to day has been your sort of way of life for many, many years before surgery. And so after the fact, you think, why is my pain still here? Well, just think of it as a journey and a thing that will take some time, and sort of having some better understanding as to why you're having pain is also a good way to understand, that it will not be there forever. So just a quick recap. Your first few days after surgery, pain will be the most intense, but don't panic. It is short and it will resolve soon. Your first few weeks are very difficult as well, but the pain should be easing around the 2-week mark. From 2 weeks to 6 weeks, it's where you're starting to get a little less pain. You're moving a little bit more, feeling a bit more like yourself, adding activities in slowly but steadily. And then from 6 weeks to the few months after surgery, that's when things should really start to be easing off and turning a corner for you. From 4 to 6 months, it's getting back to daily routines that can really sort of set you up for success in the long-term recovery. But don't forget that pain is your sort of warning sign of areas that you need to continue to work on. And then from 6 months to a year or onward, this is where your day-to-day management of your knee pain may vary completely based on what you've been up to activity-wise. If you're still experiencing pain at this point, dealing with someone who can help you with your chronic pain symptoms, that can be really, really helpful. Anyways, I hope this video is giving you some good insight onto what the pain sort of trajectory is after knee replacement, and that it will come to an end. Do not forget that.